Well, joining us on the program is Teryn Clarke. She's a neurologist with Hoag Hospital, and we want to thank you so much for joining us today on the program.
Thank you for having me.
We have a very important subject, I think, that we can discuss today, and obviously this is in your profession. And today we're going to learn a little bit about dementia and Alzheimer's. And everybody kind of thinks they're the same thing, but yet they're different. So tell us, what is dementia, first of all?
Yeah, it's a really important distinction to make, and I agree with you. I think a lot of people use those terms interchangeably. They really aren't. So when we talk about dementia, that really describes a level of function such that somebody might have trouble paying their bills or driving or cooking or doing the things they used to do on a day-to-day basis. So it's really a description of function. It's more of a symptom than a disease itself.
So it's not the coming on of Alzheimer's. It's more of a, it's a symptom in itself then.
Absolutely, and I think an easy way to understand what it means is if we talk about fever and the flu.
Right.
Fever is a symptom, and the flu can cause a fever, but every time you have a fever, it doesn't mean you have the flu.
Right.
And so Alzheimer's disease and dementia are similar. Dementia is a symptom of difficulty thinking and doing the things people used to do, but not all dementias are caused by Alzheimer's.
Right.
We actually find a lot of times it's untreated general chronic medical conditions, undiagnosed diabetes, or sleep problems. So when somebody's having a change in the way they think or function, it's really important to determine what's causing that, because it isn't always Alzheimer's disease.
Okay. And what is the definition then, do you feel, of Alzheimer's? And is that more of a physical change in the body then?
It is, and we have such a good understanding of the chemical basis and the changes that happen in the brain. So we really define Alzheimer's disease as a process of proteins building up in the brain, and they can eventually become destructive and then cause people's cognition to change.
Right. And that's when you talk about plaques and tangles.
Exactly. That's
so
exactly what
those
we're
are
talking
things
about.
that start to happen within the brain that obviously will alter all the function and cause memory loss and other different things that happen with this disease.
Exactly. Now we can pick up this disease so much earlier and really prevent it from causing a severe dementia.
Right. So what are the early signs of something like that? Because I know the example I've heard is if you've forgotten where your car keys are, that's pretty, we do that all the time. I've been doing that forever. But if you forget where you parked your, where your car is or where you're at, then that's a little bit different. So the symptoms are gradual though.
They are gradual, and what we usually first see are some short-term memory problems, forgetfulness, more repeating questions, repeating ourselves. That's a really early sign. I try to educate people that we all go into a room and forget why we went there. We wonder why we're in the garage. We have to go back to the kitchen to figure it out.
Right.
And so I'm not too concerned if you go back to that first room and it comes back. When I start to get concerned is that it never comes back why you went to the garage to find something, or that you don't remember that you were supposed to get something in the first place. So it is important to distinguish normal aging and normal day-to-day forgetfulness from something more. And that's why screening for memory disorders becomes so important to help distinguish between those two.
And how does that process work? How can people detect that? And then how do they handle the screening when usually that person isn't functioning properly anyway? So is it usually a family member or somebody that gets them to that process?
Often it is, but what we're lucky to live in Orange County because in Orange County we've instituted the national guidelines for detecting memory disorders early. And so what we encourage people to do is whether or not they think there is a memory problem, to come get their memories screened. If there's no memory problem, then we have a really good baseline. And with annual screening, we can detect any early changes way before they're detectable by even family members. So we encourage, just like people get their blood pressure checked every year, they get their cholesterol checked every year, they should get their memory checked every year. It's as important, if not more so.
Wow. So we're a 55 plus community, so do you suggest at 55 that you do that on a yearly basis?
Absolutely, and we suggest if there's a history of memory problems in the family, that people start screening at 45. That's when our memory starts to change, actually. After 45, we start to lose a little bit of short-term memory, just as a function of normal aging.
Do you think that's something they can talk about with their general practitioner and say, not only do I want my blood pressure checked, this and that, do you have this available where I could get this screening done?
Yeah, so what we're trying to do at Hoag is we have a very sensitive memory test, and we're trying to get more of the community docs to administer that test, and we have quite a few who do. In the past, the testing has really just detected dementia, and as far as we're concerned, that's too late. We want to pick up people when they have just very mild changes, so we can prevent them from having dementia. So they can ask their primary care doctor, or they can come through our screening program. We screen all over Orange County, including at the Florence Sylvester Community Center.
Perfect. Okay. Well, that's the thing to do then.
Absolutely.
Now, there's no cure for this disease, do we know of? And we're still trying to figure out what is causing it. You know, from the examples I've seen, it's almost like a piece of fruit that's been left out in the sun that looks so much different than something that had been sitting in the refrigerator, just kind of starting to deteriorate and kind of dry up, it seems like. But right now, is there a cure on the horizon? It's the sixth leading cause of death in the United States now, so we have the silver tsunami coming, so do you see something happening in the next 10 to 20 years?
There's a lot of good news. There's a lot of good research going on. With what we have FDA approved right now for treating Alzheimer's disease, we can slow down the progression of that disease by 50 to 100% when we combine that with exercise and lifestyle changes. So we can do a lot now, especially if we detect early. But there are several medications in phase 3 clinical trials, which means if they're effective, they may be out in the next year or two. And they, in the early studies, are really promising for slowing the disease down even to a greater extent, so that we can maintain good quality of life. We don't have a cure on the horizon, but I'm confident with the scientific studies that are underway throughout the world that in the next 15 to 20 years, I think we're going to know how to prevent this disease altogether.
Do you think it's hereditary?
There's definitely a hereditary component. Some of those genetic factors we can test for, and we do at Hoag. Some of those we haven't discovered yet. So it's there are many factors, and environment is certainly, and lifestyle. Absolutely.
And do you think the population growing to an older age is also a factor in this? Because, you know, back in the old days, if grandpa was a little off, we just said, oh, he's a little senile. And nobody really, you know, you don't think of that. But you know, maybe they were passing away in their 60s, early 70s, and now most people are living to 90s and even 100s now. So has age, do you think, really been a cause of that?
Yeah, age definitely is a risk factor, and we find that at age 85, about 50% of the population are showing some signs of Alzheimer's disease. So as we age, certainly those statistics go up, and we do want to pick up people early so we can prevent the onset of symptoms, even if those proteins are starting to build up in the brain.
And the interesting thing too, just like our demographic in our community, 2/3 of Alzheimer's patients are women. So that's kind of interesting too, because you know, men get the high blood pressure and the heart disease, and women seem to now tend to get Alzheimer's.
So we recommend everybody screening because everybody's at risk.
Now, I used to see our volunteers, especially in the lobbies, you know, doing the crossword when people used to read newspapers. And now we have technology, and you have all these cognitive drills that people can do online and with their phones. Do you think those have been helpful? You know, just keeping the mind a little sharper?
Yeah, I think those are helpful. What's really most helpful are physical exercise and new learning. So we need to exercise the body and exercise the brain. So taking classes, especially in a social environment, is by far the best thing you can do to exercise your brain. I think of those online studies as,
the games.
Exercises as more of kind of a multivitamin. I would love to see people reading, taking classes, learning new things, working on a language they used to know. But if they can't do that, then at least get a basic exercising of a lot of different areas of the brain on one of those websites that you can do.
Yeah, one of the nice things too, especially about our community, is that we have the Emeritus program. So I know a lot of people, you know, they're taking those classes just to keep busy. They've maybe found a new language that they're learning, but those are the kind of things that are really going to help them get through something like this. And, you know, let them live a healthier and better life.
Exactly. So I'm happy to hear that people are really taking advantage of those programs that are there, and keep doing it. Sign up for more, learn more, exercise your brain. It's so important.
Very good. Well, you're going to have screenings at the Florence Sylvester Senior Center. I imagine those are particular dates and times. So
yes, we because we screen all over Orange County, there are set dates of the week, and they're somewhat flexible. But people can find out about that by going to ocbrain.org, and like Orange County Brain, and find out. They can do an online memory screen that'll give them some information, and then schedule an appointment, or they can call Hoag directly.
And we will have them give them a call at 478-8858 if you have any questions regarding this as well. And then, of course, we're friends with the Florence Sylvester Senior Center, and when Shirley and Cheryl come on, we'll be sure to mention when those screenings from Hoag are at their facility. And like I said, continue reading, and even though people are on their little phones all the time, sometimes it's really helpful so that we can hopefully one day beat this disease, especially for people our age, as this silver tsunami is going to come through, and then we're going to be washed up after them. So it's going to be, wow, what's going to be happening, in the future. So we're looking forward to hopefully finding a cure for this, terrible disease.
Yeah,
so
that's the goal.
Thanks so much for joining us on the program. Great information, and it's a pleasure to meet you.
Nice to meet you too. Thank you for having me.
You bet. Be sure and give them a call. That's at Hoag, 478-8858. Or if you want to go online, go to ocbrain.org and check out some of those cognitive lessons as well. We'll be back with more of our program right after this.